Hey everyone, and welcome back to the channel. Today we're diving into something super important for a lot of you, especially if you're approaching that golden age of 65. If you're turning 65 soon, or know someone who is, this video is a must-watch because we're talking about Medicare. Did you know that over 60% of people miss crucial tips during their Medicare pre-enrollment, leading to headaches and higher costs down the line? We don't want that for you. You've worked hard your whole life, planned for the future, and now it's time to enjoy the fruits of your labor without worrying about healthcare costs. The thought of navigating Medicare can feel a bit like trying to solve a really complicated puzzle, right? All those forms, all those choices, it can be overwhelming, but trust me, it doesn't have to be. We're here to make it simple, clear, and even a little bit empowering. Think of this as your friendly guide, holding your hand through the process, ensuring you feel confident and ready. We're going to break down the most vital steps for your pre-enrollment checklist, helping you make informed decisions that are just right for your unique situation. So, let's get started and clear up some of that confusion, shall we? The first and arguably one of the biggest decisions you'll face is choosing between Medicare Advantage plans and Medicare Supplement plans, often called Medigap. This choice is foundational, and it really shapes your healthcare experience for years to come. Many folks get stuck right here, wondering what the real difference is and which path is best for them. Let's demystify it together, because understanding this distinction is key to unlocking peace of mind with your healthcare. Imagine Medicare Part A and Part B, which are often called Original Medicare, as the foundation of a house. Part A covers hospital stays, skilled nursing facility care, hospice, and some home health care. Part B covers doctor visits, outpatient care, medical supplies, and preventive services. Now, Original Medicare covers about 80% of your approved medical costs, leaving you responsible for the remaining 20%, along with deductibles and co-payments. This is where Medicare Advantage and Medicare Supplement plans come into play. They help fill in those gaps. Let's start with Medicare Advantage, also known as Part C. Think of Medicare Advantage plans as an all-in-one alternative to Original Medicare. When you choose a Medicare Advantage plan, a private insurance company, approved by Medicare, actually provides your Part A and Part B benefits. These plans often bundle in additional benefits that Original Medicare doesn't cover, like prescription drug coverage, Part D, vision, dental, and hearing. Some even offer fitness programs or transportation to appointments. The way Medicare Advantage plans work is often similar to the health insurance you might have had during your working years. You'll typically have a network of doctors and hospitals, and you might need referrals to see specialists. There are usually co-payments and deductibles when you receive services. The big upside is that they have an annual out-of-pocket maximum. Once you hit that cap, the plan pays 100% of your covered medical expenses for the rest of the year. This provides a sense of financial predictability, which many people find incredibly reassuring. However, the trade-off is often less flexibility in choosing providers and potentially higher out-of-pocket costs until you hit that maximum. Now, let's look at Medicare Supplement plans, or Medigap. These plans are different because they work with your Original Medicare. If you choose a Medigap plan, you keep your Original Medicare, Part A and Part B, and the Medigap policy helps pay some of the remaining healthcare costs that Original Medicare doesn't cover. This means it can help with your 20% coinsurance, deductibles, and even foreign travel emergencies. The beauty of Medigap plans is the freedom they offer. With Original Medicare and a Medigap policy, you can generally see any doctor or hospital in the country that accepts Medicare without referrals. This can be a huge benefit, especially if you travel frequently or have specialists you want to continue seeing. There are standardized Medigap plans, labeled A through N, so a Plan G, for instance, offers the same core benefits no matter which insurance company sells it. You'll pay a monthly premium for your Medigap plan, and usually there are very few, if any, out-of-pocket costs when you receive care, as the Medigap plan covers most of those deductibles and co-payments that Original Medicare leaves. The main thing to remember is that Medigap plans generally don't include prescription drug coverage, so you'll need to purchase a separate Part D plan for that. So, how do you decide which path is right for you? It really comes down to your personal priorities, health needs, and financial situation. Let's think about some common scenarios. If you value predictability in your out-of-pocket costs, enjoy integrated benefits like vision and dental, and are comfortable with a network of providers, a Medicare Advantage plan might be a great fit. Many people find the lower monthly premiums and the bundled benefits of Medicare Advantage appealing. My friend Sarah, for example, chose a Medicare Advantage plan because it included her prescription drugs and offered a gym membership, which was perfect for her active lifestyle. She loves that everything is under one umbrella, and she knows her maximum out-of-pocket exposure each year. On the other hand, if you prioritize maximum flexibility in choosing your doctors and hospitals, travel a lot, or have chronic conditions where you want to minimize out-of-pocket costs at the point of service, a Medigap plan paired with original Medicare and a separate Part D plan could be ideal. My uncle, a retired professor, travels extensively and sees specialists all over the country. He chose Medigap Plan G because he wanted the freedom to choose any doctor who accepts Medicare, without worrying about networks or referrals, and knowing most of his costs are covered after his initial premium. For him, the higher monthly premium for Medigap was worth the peace of mind and flexibility. It's also important to consider your health. If you're generally healthy and don't anticipate many doctor visits, an Advantage plan with its lower premiums might seem more attractive. However, if you have ongoing health issues, a Medigap plan might save you money in the long run by significantly reducing your co-payments and deductibles every time you visit the doctor or hospital. It's about weighing those potential future costs against the current premiums. Another crucial factor is timing. The best time to enroll in a Medigap plan is during your Medigap open enrollment period. This period lasts for 6 months and begins the month you turn 65 and are enrolled in Medicare Part B. During this time, insurance companies cannot deny you a Medigap policy or charge you more due to pre-existing conditions. If you miss this window, you might not be able to get the Medigap plan you want, or you could face higher premiums due to medical underwriting. For Medicare Advantage, you typically enroll during your initial enrollment period, which is around your 65th birthday, or during the annual enrollment period each fall. This isn't a one-size-fits-all decision, and that's perfectly okay. What works brilliantly for your neighbor might not be the best fit for you. Take your time, do your research, and consider your personal healthcare needs, your budget, and what gives you the most peace of mind. Remember, this is about your well-being. To truly make an informed choice, I strongly recommend talking to a licensed Medicare advisor. These experts can look at your specific situation, discuss your doctors, medications, and financial preferences, and then help you compare plans side by side. Their guidance can be invaluable in navigating the nuances and ensuring you select the plan that truly meets your needs. Many reputable organizations also offer free counseling services that can help. Look for resources from your state health insurance assistance programs, also known as SHIP, or the official Medicare website. These are fantastic, unbiased sources of information. The takeaway here is not to rush this decision. It's okay to feel a little unsure at first. The goal is to gather information, understand your options, and then choose the path that makes you feel most secure and confident about your healthcare future. By understanding the core differences between Medicare Advantage and Medigap plans, you're already taking a huge step towards making a brilliant choice. We've just scratched the surface of your Medicare pre-enrollment checklist, and there's so much more to uncover. If this discussion has sparked more questions, that's fantastic. It means you're actively engaging with this important topic. Thank you so much for joining me today. Your health and peace of mind are incredibly important, and I truly hope this video has brought some clarity to your Medicare journey. If you found this information helpful, please give us a thumbs up, subscribe to the channel for more valuable insights, and hit that notification bell so you don't miss out on our next video. And don't forget to share this with anyone you know who might be approaching Medicare age. Let's help everyone make the best choices for their future. Take care, and I'll see you in the next one.